preparing physicians for personal practice. And our site is a rural site. I'm in Etowah, North Carolina, and we've had a lot of innovation.
Being a part of the P4 program is actually a big draw to our residency program initially.
And the goal, in a broad strokes of the program itself, is to open the way residencies are structured.
Thinking outside of the box on what residency training is supposed to be and what we're supposed to learn within our short time, just 3 years of training.
And that's part of how it was structured, was so that it could change and adapt as new technologies arise, as new ideas come in from the people who are actually doing the care, like the residents.
We see patients that are a little bit more geographically isolated and from a little bit more socioeconomically isolated as well. And it's a real benefit for us to even get to see these patients in residency, to understand the difficulties in caring for them as a provider, and to be able to relate to them as patients.
Working here has made me realize how much more personable relationships can be and how much more intricate you can be with families and really feel like you're making a difference.
These clinics that were advancing this concept of the patient-centered medical home would be specifically placed in communities that are rural.
In this particular residency's P4 project, we've chosen to integrate technology in a number of different mechanisms.
Information technology that a lot of people are used to using in any other sort of service sector.
And it really gets us away from a very patronizing form of medicine where an individual comes to the doctor and then basically gets spoken to only to walk away with the physician's orders.
I think it really is changing the face of family medicine, because what it's trying to do is be able to empower the patient to really take control of their own health issues.
In this case, it offers people, at least it gives them the option of taking over their health care, of being put in the driver's seat just a little bit more than where they had been previously.
I have had patients in the past that haven't been able to make it into the office because of the transportation issues and because of the fact that they can email me. I've had that happen several times where I've received emails and be able to respond to them or call them and address any concern that they have that normally wouldn't have happened if we didn't have that.
And I like the ability to know that I'm maintaining that contact with my patient, even after they leave the building.
Having been here for the last 3 years and working in the P4 curriculum has definitely given me a sense of how to connect the science and the everyday patient care.
Pulling in internet sources, up-to-date databases, etc., we can reduce the geographic isolation that can happen.
If the patient needs to follow up with a question, or they have a new problem and they wonder if they need to be seen, it's easy for them to either use the telephone or even just send me an email through the patient care portal.
You can send your prescriptions through the internet, to a pharmacy, so that you don't have to give any prescriptions to the patient.
To get decisions made in real time, so you don't have to, wait for an appointment 3 weeks down the line to make a minor change or ask a question.
It makes access to the physician quite a bit better.
And for people here in a rural area to experience that kind of stuff is I think very exciting.
A lot of the times physicians cringe because of the workload, and what I've noted specifically is that it doesn't actually add any more workload. In fact, it actually adds meaning to the patient-physician relationship when there is that element of trust.
Patients are loyal, like they want to be here and they don't want to go somewhere else even if it's inconvenient. And I have I have patients who travel an hour.
A big part of why I like it here is it's a lot of variety, and a lot of times it is people that need a lot of care because they haven't had it available to them in the past.
I think if you were, receiving care in a more kind of centralized, busy, urban location, you would be more of a number. I know every single one of my patients by name.
And that's probably one of the most beneficial parts of the P4 program, is forcing residents and teaching residents how to deal with these patients that are much more of a challenge from a healthcare system's point of view. And it makes us better doctors in the end, I believe.
I really do see the forefront of where family medicine is going in this program.
I definitely want to practice in a rural area and implement a lot of the things that I've learned in my experience here.
I'm practicing the kind of medicine that really I envision practicing, now and in the future. So to see all these things kind of come together, for me, has been, a very natural sort of feel to it.
We're changing it by providing medical care for people that really need it.
What once was innovation effectively now has become the standard.
And I'm looking forward to seeing how it continues to evolve.
It prepared me well to essentially be an ambassador and take these ideas and these concepts to the rural locations.
Whether it's a farmer or a lawyer, it's been good.